The world has barely begun to heal from the wounds inflicted by the COVID-19 pandemic. Yet, the spectre of another global health crisis looms. This time, the enemy is not a familiar foe, but an unknown lurking in the shadows. Disease X, as it is ominously called, represents the very real threat of a novel pathogen emerging with the potential to wreak havoc on a global scale. Disease X is not a specific disease, but a placeholder. It signifies the potential for a catastrophic pandemic caused by an unknown pathogen. The term was coined by the World Health Organization to underscore the need for preparedness in the face of an unpredictable future. This is not a mere theoretical exercise. The emergence of new diseases is a constant threat, driven by factors such as climate change, globalization, and the encroachment of human activities into wildlife habitats. The next pandemic could originate from a virus jumping from animals to humans, a bioengineered pathogen, or a completely unknown source. The shadow of Disease X is a stark reminder of our vulnerability. It compels us to confront the possibility of another global health crisis, one potentially even more devastating than COVID-19. The question is not if, but when Disease X will emerge, and the time to prepare is now. Disease X is not a defined entity, but a placeholder for a future pandemic threat. It represents the very real possibility of a novel pathogen with unknown characteristics and transmissibility emerging and spreading rapidly across the globe. The very essence of Disease X lies in its uncertainty. The concept of Disease X highlights a crucial aspect of pandemic preparedness, the need to anticipate the unknown. Traditional approaches, focused on known threats, are insufficient. We must develop flexible systems and strategies capable of responding to a wide range of potential pathogens, regardless of their origin or characteristics. This requires a shift in our thinking. We must move beyond reactive measures, scrambling to contain outbreaks after they occur. Instead, we must adopt a proactive approach, investing in surveillance, early detection, and rapid response capabilities. This means strengthening global health systems, fostering international collaboration, and prioritizing research and development of broad-spectrum antivirals and vaccines. The threat of Disease X is not a cause for despair, but a call to action. By embracing the unknown and preparing for a wide range of scenarios, we can mitigate the potential impact of future pandemics and protect global health security. The COVID-19 pandemic has left deep scars on public trust in health organizations and scientific authorities. Years of misinformation, politicization of public health measures, and inconsistent messaging have eroded public confidence, creating fertile ground for distrust and skepticism. This erosion of trust poses a significant challenge in the face of Disease X. Public acceptance of health recommendations, adherence to preventive measures, and willingness to participate in vaccination campaigns are crucial for effective pandemic response. However, skepticism towards health authorities and scientific evidence can undermine these efforts, hindering our ability to control outbreaks and protect vulnerable populations. Addressing this crisis of trust requires a multi-pronged approach. Health organizations must prioritize transparency, clear and consistent communication, and community engagement. Efforts to combat misinformation and promote accurate information are paramount. Building trust takes time and consistent effort, but it is a vital investment in our collective future. While Disease X remains an unknown entity, there are existing threats that provide a glimpse into the potential dangers we face. One such threat is the highly pathogenic avian influenza virus, H5N1, commonly known as bird flu. H5N1 has been circulating in bird populations for decades, causing widespread outbreaks and raising concerns about its pandemic potential. H5N1 is highly lethal in birds and can also infect humans, albeit with lower frequency. However, the virus's ability to mutate and adapt poses a significant risk. Should H5N1 acquire the ability to spread efficiently among humans, it could trigger a devastating pandemic. The recent outbreaks of H5N1 in mammals, including mink and sea lions, are a cause for serious concern. These cases demonstrate the virus's capacity to jump species and potentially adapt to new hosts. The more the virus spreads, the greater the opportunity for mutations that could enhance its transmissibility in humans. The threat of H5N1 serves as a stark warning. It underscores the need for constant vigilance, robust surveillance systems, and proactive measures to prevent the spread of zoonotic diseases. Vaccines are a cornerstone of pandemic preparedness, offering a crucial line of defense against emerging infectious diseases. However, the development of effective vaccines is a complex and time-consuming process, fraught with scientific and logistical challenges. One of the main challenges in vaccine development for disease X is the unknown nature of the pathogen. Without knowing the specific characteristics of the virus or bacteria, designing a targeted vaccine is impossible. This necessitates the development of platform technologies that can be rapidly adapted to different pathogens, accelerating the vaccine development timeline. Another challenge lies in the manufacturing and distribution of vaccines on a global scale. Producing billions of doses of a new vaccine requires immense manufacturing capacity, efficient supply chains, and equitable distribution networks. These logistical hurdles must be addressed to ensure that vaccines reach those who need them most, regardless of geographical location or socioeconomic status. Investing in vaccine research, development, and manufacturing capacity is a critical aspect of pandemic preparedness. By supporting innovation and building resilient supply chains, we can accelerate our response to disease X and mitigate its impact on global health. The COVID-19 pandemic served as a stark reminder of the importance of pandemic preparedness. The world was caught off guard, scrambling to respond to a rapidly spreading virus with limited resources and inadequate infrastructure. The consequences were devastating, leading to millions of deaths and widespread economic disruption. The COVID-19 experience provided valuable lessons that must inform our approach to disease X. First and foremost, we must prioritize investment in public health infrastructure, including robust surveillance systems, well-equipped laboratories, and trained healthcare personnel. These are the foundations of an effective pandemic response. Second, we need to strengthen global cooperation and coordination. Pandemics know no borders, and a coordinated global response is essential to contain outbreaks and mitigate their impact. This includes sharing information, resources, and expertise across nations. Finally, we must learn from the communication failures that plague the COVID-19 response. Clear, consistent, and evidence-based communication is crucial to build public trust, counter misinformation, and ensure adherence to public health measures. Disease X is not a challenge that any nation can face alone. Pandemics transcend borders, and a coordinated global response is paramount. International collaboration is not merely a matter of choice, but a necessity for effective pandemic preparedness and response. Sharing information and resources is crucial. Early detection of outbreaks, rapid sharing of genomic data, and collaborative research efforts are essential to understand the threat and develop effective countermeasures. Global surveillance networks, data sharing platforms, and joint research initiatives are vital components of a united front against disease X. Equitable access to vaccines, therapeutics, and other essential medical supplies is another cornerstone of global solidarity. Ensuring that all countries have the resources they need to protect their populations is not only a moral imperative, but a strategic necessity. A pandemic uncontrolled in one part of the world poses a threat to all. Global unity in the face of disease X is not merely a lofty ideal, but a pragmatic approach to safeguarding global health security. By working together, sharing knowledge, and supporting each other, we can mitigate the impact of future pandemics and build a more resilient global health system. In an era defined by information overload and the rapid spread of misinformation, the power of knowledge and accurate information is more important than ever. The fight against disease X is not only a scientific and medical battle, but also a struggle against the insidious effects of misinformation. Misinformation can erode public trust, undermine public health messaging, and hinder efforts to control outbreaks. False claims about disease origins, transmission, and prevention can lead to confusion, fear, and non-compliance with public health measures. In the context of Disease X, where uncertainty is inherent, misinformation can thrive, exacerbating the challenges of pandemic response. Combating misinformation requires a multifaceted approach. Promoting health literacy, empowering individuals to critically evaluate information, and fostering a culture of scientific skepticism are essential. Strengthening the credibility and reach of reliable sources of information, such as public health agencies and scientific organizations, is crucial. Social media platforms and technology companies also have a responsibility to address the spread of misinformation on their platforms. Implementing policies to flag or remove false content, promote authoritative sources, and educate users about misinformation are essential steps in mitigating the harmful effects of misinformation. The shadow of Disease X looms large, a stark reminder of our vulnerability in an interconnected world. The threat of a novel, highly transmissible pathogen emerging and spreading rapidly across the globe is real and ever-present. However, the future is not predetermined. While the emergence of Disease X is a matter of when, not if, our preparedness and response can shape the trajectory of its impact. By investing in public health infrastructure, strengthening global collaboration, promoting accurate information, and fostering public trust, we can mitigate the potential devastation of future pandemics. The fight against Disease X is not merely a scientific endeavor, but a collective human endeavor. It requires a shared commitment to global health security, a willingness to learn from past mistakes, and a recognition that our interconnectedness demands a united front. The future may hold unforeseen challenges, but the human capacity for innovation, resilience, and collaboration offers hope. By embracing the unknown, preparing for the unexpected, and working together, we can face the future with courage and determination, ensuring a healthier and safer world for all.